If you can't go left, you can always try right. If you can't go right, you can always try forward. But no matter what you do, we'll always create a memory because you are special.
Hello, and welcome to RBV, the Milestone Whisperers, where we discuss milestones and the journeys to get to them. I'm your host, Dr. Rashida, and welcome back to a new episode. Um, Today I'm talking about um, a personal milestone for me. I guess it's more a professional milestone for me, um, but it's been impacted by personal reasons. So you all know that my favorite group of people to serve or age group that I like to work with are pediatrics, primarily early intervention. So those infants and toddlers, birth to 3-year-olds. I love that age group. What got me into early intervention was when I became a mom. So a classmate of mine from PT school um, had introduced me into early intervention, but that passion for it was just watching my children grow and monitoring their milestones. All of them met their milestones um, on time. But just like being a mom and watching them grow along with my clients was very rewarding to me. Um, My kids are getting older, so they are way past the early intervention phase. I have boys that are teenagers. My daughter just turned 10. So I've been evolving as a therapist and just as a mom. But also, my kids, they all play sports. So I'm far removed from orthopedics and sports injuries, and that was never my strong suit anyway. I did work in outpatient, but um, not sports related injuries. So that's definitely not my strong suit. So when they have had their injuries, I have one of my sons. I actually took him to a specialist, a specialist, a PT specialist. There's a PT that specializes in orthopedic conditions and sports medicine, because I know that's not my lane. Um, so he did really well. I reinforced his exercise program. I had taught him some exercises prior to going to um, physical therapy for himself. That son, he had fractured his ankle. He had a small fracture in his ankle, so he had to wear a cast for 3 weeks. He had to use crutches. I had to drop him off to school um, for 3 weeks and then beyond, because then after the cast, he was in a boot, but still using crutches. So I took him to school rather than having him ride the school bus. So I'm evolving as a therapist, and sometimes in early intervention, just that snapshot of life from birth to 3 years old is such a vital part of development. Um, but I started to feel like, now don't get me wrong, I am very challenged with the babies that I work with because I have a whole host of diagnoses that I work with, from autism to cerebral palsy, Down syndrome, genetic conditions where I had to look stuff up. So I don't want to make it seem like I'm not challenged in early intervention. I love the babies, and that will always be my preference as far as the age group that I'll love to work with. However, my children are getting older, my family members are getting older, and I started to reflect on over the past couple of years on how can I advocate for my family as a physical therapist as best as I can. And so it was a tough decision to kind of like step away from like solely being an early intervention physical therapist. And I started getting into home care. And that's what I've been doing. Just on the side. So I still carry a very full caseload with the babies, with the infants and toddlers, because I love them so much. But I've been getting into home care because I want to stay on top of adult diagnoses. I want to stay on top of like just some of these things that I don't see with the babies. I had a recent workers' comp case where um, my patient broke fractured a bone in their leg, and it was it was very interesting, relearning, like not relearning, but just reigniting those neural pathways in my brain about orthopedic diagnoses and orthopedic conditions and what muscles to work for that particular patient. And um, it's been rewarding, I will say. I've had family members that have had medical conditions where I get to advocate for them by speaking with their physicians and speaking to social work and things like that that I don't necessarily get to do all the time as an early intervention physical therapist. Um, and when I think about it, I got into physical therapy primarily because of my dad when I was first entering college. My dad had stomach cancer and he ultimately passed away during my first semester of college. So I was really young and I wasn't in the medical field at that point. But that drove me to want to be on the rehabilitation side of it. Um, and in retrospect, I'm kind of like getting back into that. Like, I don't wish any of my family members to need like major, major medical care, but being realistic, as we age, different conditions come about. Strokes could happen, even just, high blood pressure. I had a family member that had open heart surgery this year. And man, I had to just go back and think about when I was in acute care. I was an acute care physical therapist for a long time. And just the inpatient setting and just being in the ICU and remembering like all the numbers that's on the screen and all the medications and all those things. And it was invigorating to me. Like I was advocating for this person at the same time, but I was kind of like, oh, I remember this, like just getting out of bed and encouraging them to use their incentive spirometer and just all those things kind of came back to me from when I worked in a hospital setting. Um, Although I prefer the freedom of going from, not being confined to one place. So I love home care in general. Um, and that's what I do with my with the kiddos that I see. I do home care visits or either daycare visits. So I'm going from place to place and I'm kind of like a nomad. I never stay in one place. I kind of like that. I like the freedom to be able to like reflect between my patients, not have to like go from one room to the next. How I did when I was in an inpatient setting. Also, I just like that. Like I need to decompress a little bit. So like going from one to the other gives me that time. But it's a hustle. So whereas when I'm working with the babies, um, I work with the families as well. So I work with moms primarily, but a lot of grandparents and a lot of I'm getting like more fathers involved, which is really cool, because it is a family thing. But sometimes I have to modify how I coach the families because sometimes I work with a grandparent that can't get on the floor with their grandbaby, but they are the primary caregiver for their grandbaby during the day while the parents work. So I had to kind of modify how I'm coaching those families, because in early intervention, that's what we do. We coach the families to work with their child to get them to their developmental milestones. Um, I'm kind of a coach with adults as well, but I'm more hands-on because that's more clinical, that's more medical. Whereas with early intervention, I'm coaching. So like I kind of dabble in between the two. In the ideal world as a physical therapist, I would love to be in the middle, because even sometimes with the babies, I am more hands-on than some therapists may not be, because there's certain things that I want to use my skill set to work with the child. And then I empower those families to do these things. For instance, I have a family where the mom physically was not able to walk up and down the steps with the child. So I did that, so I didn't coach her to walk on the steps with the child. I did it, although we use a coaching model primarily in early intervention, but she just wasn't physically able to do that. So I kind of like to bridge or like meet in the middle of coaching and clinical care for all my families, all the clients, all my patients that I work with, because I think overall that's how I serve them best, and that's the best way for them to get better, is for me to have that approach. And I think that's a unique approach. But this milestone, and I've been like rambling a little, but the actual milestone is me finding my niche. I don't know. I hear it pronounced different ways. I've always said niche, but I hear people say niche. So niche, I don't know. But I'm not just an early intervention physical therapist. I'm not just a geriatric physical therapist, because that's the runner up for the favorite age group that I love to work with. I'm not just that person. I consider myself to be an intergenerational physical therapist. And what that means is that I'm bringing generations together. During all of my sessions, regardless of if it's with a young child, an infant, a toddler, all the way up to my most recent patient was 82, I believe. I love that age group. Oof. They're just so like wise and just fun to work with. But I try to incorporate the whole support system. Some people are alone, especially like some older patients that I have, they are alone, so I don't get to meet like their grandchildren or their children or other family members. But when I can, I like to include all of them and empower all of them. It's a family affair. We are all together, working together to move together. So that's why I don't know if I coined the term or if I invented the term, but I am an I can't even get it out. By the way, guys, I have Invisalign now. So I took them out because I I speak with a lisp when I'm wearing them. But I still like with the attachments that's on them, that's on my teeth, even when I remove the Invisalign, I still speak a little bit funny. So words are coming out a little bit weird, but I am an intergenerational physical therapist. That's me, Dr. Rashida. Um, I hope that makes sense. I am going to elaborate more on that in a blog post for those people that love to read rather than watch videos. I'm actually trying to get more into reading again, um, because the screens could be very distracting, overstimulating and everything. So I'm trying to get more into reading. So look out for a a post about it, so I'm going to send you to a screen to um to read my blog post. However, I'm going to elaborate a little bit more on how I arrived at coining the term or identifying myself as the intergenerational physical therapist. I just love it's a whole mouthful, but I just love saying that because I'm not just a one age group person. I love, love, love the babies. I love, love, love the elderly, but I just love helping people in general. Now, mind you, I'm not a physical therapist for everyone. So when I say I work with workers' comp patients, they could be baby boomers or they could be, young adults. I'm not an expert on any age group. Um, Besides early intervention, because that's my heart. But when my family member had open heart surgery, and the home PT came, I just had the home PT come just, to go through her whole rehab process. But when it was time for her to do cardiac rehab, I recommended for her to go to cardiac rehab. I did not I know my lane. Same thing with my children, as I said. When they have their sports injuries, they go see a sports physical therapist. Um, I just know my lane. But I also, went through PT school so I can treat anyone. And I do feel confident treating most diagnoses and most age groups and most, all the things, hence being an intergenerational physical therapist. I just love helping um, people within families, and it kind of helps other people within families. So, for example, like um, that parent that wasn't physically able to go up and down the steps initially when I first started working with her child. Now that she is able to go up and down the steps, she practices the steps. So it wasn't like I was doing the work for her, you know. Um, in that moment I was when she wasn't physically able to. But um now that she's physically able to, she does the steps with him during my sessions, and that is just something that's so proud for me to say because I didn't do conventional coaching. Um, However, I still taught her how to be confident doing the steps with her child. Um, another grandparent can't get on the floor, just can't. She's older and just can't get on the floor. So she has modified her space so that way she could do tummy time with the baby on the couch, sometimes on the bed, but still getting in good tummy time. And as the baby starts to get older, I'll help modify my treatment approach because it's not cookie cutter. It's not um, one one fix for every person that I see. Is individualized, and I just pride myself on that. So that's my milestone, identifying my niche, being an intergenerational physical therapist, where my heart belongs to the pediatrics, primarily early intervention. Um, Although my favorite age group are the preschoolers because they have some sass. When they turn 3, they get a little bit feisty. But also just cognitively, they could understand a lot more. So I could be a little bit more creative with like creating obstacle courses and having them um, actually take part in creating obstacle courses. Whereas when they're like infants and toddlers, they kind of gotta just go with the flow, even though you follow their lead as they get a little bit older with their play. But those 3 to 5 year olds, they're really fun. Um, yeah, just that age group, they just are fun. They're just fun in general. Um, But yeah, so I hope this episode resonated with someone out there. Please share, please comment. Um, I am on YouTube, RBV, the Milestone Whisperers. I'm on Instagram, RBV, the Milestone Whisperers. I also have a professional PT page where I share tips, um, RBV physical development, and I have a TikTok, RBV physical development, and I'm on Facebook, RBV physical development. Stay tuned. I've been away a little bit from posting. Because I have some things behind the scenes that I'm working on. So I'm super excited to be sharing that really soon. And I'll be quite honest, I've been having the winter blues. I haven't really been wanting to do anything besides just do the work that I gotta work, do the work that I gotta do, and um, tend to my family. But other than that, I haven't really been on social media as much as I should creating content. It's just been a little, you know, snow, cold, dreary. All that has me in a little bit of a funk, but I'm coming out of that funk, and I'm excited about sharing all the projects that I've been working on. Well, it's not like there's 100 different things, but there's a couple really cool projects that are near and dear to my heart that I can't wait to share with you all. So stay tuned for that. So until my next episode, see you soon. Bye.